podcast of PTA. We have with us Dr. Ritu Sigh, Associate Professor, Department of Critical Medicine, posted at IGIMS Patna. Before we start, we, the members of PTA, express our heartfelt condolences to Arohi Shikha, student of Class 8, who left us for heavenly abode. Our thoughts and prayers for the bereaved family. May her soul rest in peace. With this, our today's podcast will be focused on dengue, how the deadly disease happens, what are the basic questions that arise in our mind when we talk about dengue. So Dr. Ritu will be answering our basic questions and basic doubts that we have about dengue fever. So ma'am, welcome to the podcast. Thank you. So our first question would be like, what is dengue fever? What is it basically, and how suddenly has it become so deadly?
So, before giving answer to your questions, it's really sad that a young girl has passed away and she was here with us. So may her soul rest in peace, and may God give her family the strength to overcome this loss, because it's not at all easy for any family to accept it. So coming on to the awareness of this dengue fever. So dengue fever is just like any other viral fever that happens to all of us, and it is important in this sense because it is seasonal. It happens in one particular season and in particular parts of the world only, tropical countries where there are a lot of rainforests, or tropical climate is there, so it happens in that parts of the world only. Since the incidence is increasing over the period of last 10 years, it is gaining importance, and the complications are dreaded. Mostly it is self-limiting, like most viral fevers, but very few cases the complications are dreaded like it leads to death because of rapidly evolving shock or hypotension, that is low BP. So that is the most deadly part of this fever.
So ma'am, the next question would be, how is it transmitted?
So it is transmitted through a vector. Vector is mosquito, and mosquito is our common friend in Indian households. So it is transmitted through that deadly mosquito, and the only one species of mosquito, that is Aedes aegypti species, is that. So it is easily identifiable. So it is a dark colored mosquito with got white stripes on it. It is there usually during the daytime only, more concentrated during dawn and dusk. So as a name,
what are its symptoms? How to identify that it's dengue and it's not a viral fever?
So it's very difficult for a common man to differentiate between dengue and virus. The complications happen till a very self-limiting period, or till a very minimal duration. It resembles a normal viral fever, that is associated with fever, some retroorbital pain, that is pain behind the ears, intense headache. Fever is usually, two typical features of fever are there in this. It is usually little higher grade than as compared to other viral fevers, and it has got a saddleback phenomena. Saddleback phenomena has got two peaks. So initially there's a peak. After 3 to 4 days, you feel that the fever has settled down, and then again there could be a peak. So two peaks are usually associated more with dengue fever as compared to other viral fevers, and some petechiae rash may happen if it becomes severe.
So what action needs to be taken if we hear a lot about internal bleeding also associated with dengue? So what action needs to be taken if internal bleeding happens?
So there are few warning signs of, as I told, that it is very difficult to differentiate between a normal viral fever and a dengue fever as a layman. So, and if it is in milder form, it resembles a normal viral fever. So WHO as well as ICMR India has also laid some guidelines regarding warning signs of dengue. So warning signs of dengue would be fever associated with intense vomiting, abdominal distension, that could be a sign of internal bleeding, cold clammy skin, that would show that yes, you are having low BP, headache associated with fainting episodes. So all these if are there in a person, then that person should be rushed to hospital immediately, because this cannot be managed at home.
And ma'am, it's also said that dengue mosquito remains in clean areas. Is it true?
So dengue clean, I would say stagnant water would be a better term rather than clean or dirty. So dengue, the mosquito Aedes aegypti is a very household mosquito, and not all Aedes aegypti are infected. So, but it is very difficult for us to identify which of those mosquitoes are infected. So, it is normally said that you have to eliminate most of the mosquitoes. So, it happens during rainy season only that you have to be cautious, because this mosquitoes all the year around with you, and it is a household, very domestic household mosquito that is there. So it has a preference to stagnant water which are there in and around your house, especially earthen pots, old tires, any ditches and potholes which have got stagnant water. May it be dirty, may it be clean, that's not important for its breeding. It just needs still water.
In our school premises, we hear a lot of mosquitoes breeding areas. So, how to eliminate these mosquito breeding areas?
So it's a very good question, that how to eliminate this mosquito breeding areas in and around school as well as in and around home. So during the peak season of dengue, usually the municipal corporation tries to do some fogging. So we should understand that chemical compounds are there which have been certified by WHO as well as ICM are both, that these chemical compounds are DEET and permethrin. So DEET is what they do the fogging with, so that these mosquitoes and their larvae are killed. A very simple household trick could be that wherever you see around your house or school pothole, you need to empty those potholes or earthen